okay, high, low, okay. At this point, the cat is given a medicine, a drug, I would say, a drug, that would make the heart go into like a heart attack, okay? So this is a artificially induced heart attack. And then now, you see, the blood pressure, so this went, whoa, went like this, okay? Ischemia, okay, introduced by the experiment, the researchers, okay, in the cats. Then they treat the cat with acupuncture, electroacupuncture. The needle goes in, and then electrical pulses. You see, instead of like like this, now the blood pressure is not quite normal, but it's a lot better than this. Okay, so you can see clearly these are not humans. They don't know needles from what. Actually, these cats have been anesthetized. They're not even awake. Okay, so acupuncture on an anesthetized animal, could relieve cardiac problems. But then, how does this happen? Okay, so a lot of acupuncture effects are known to be caused by the release of endorphins in the body. Okay, endorphins are your endogenous morphine. Okay, your body could secrete endorphins to kill pain, but you may not know until perhaps now that endorphins have a lot to do with cardiac function as well. So Dr. Longhurst wondered whether or not the acupuncture is causing release of endorphins, and the endorphins are normalizing the cardiac function. And to prove that point, they injected the cat with naloxone. What's naloxone? Naloxone is a drug that's used on people who overdose on opiates. Okay, if somebody overdosed on cocaine or opium, the immediate treatment is to block opiate receptors with naloxone, to block the action of opiates. And you can see here, now with the naloxone treated, the cat went back into this crisis. So what that showed is that the beneficial effects of acupuncture in relieving cardiac crisis can be blocked with naloxone. And therefore, pharmacologically speaking, you can say that the needle action is due to endorphins. So this is a pharmacological proof that that a needle here, would cause your body to secrete endorphins, and the endorphins would help relieve cardiac problems. It will also kill pain, relieve pain, but that's a different story. Now, to drive that point home, this I need to have all my lights on. Dr. Longhurst and his people slice the brain of these cats, after acupuncture, and see whether the brain actually has more endorphins, to prove it at the cellular level. So here's a slice of the brain, and they first use a green dye to stain cells that are, in this case, green are serotonin neurons, So these are neurons that have serotonin, just to identify what they are. And the same cell, here is the same cell, stains red now. Red labels endorphins. So after acupuncture, this serotonin brain cell is now making endorphins. you normally wouldn't see this unless you have acupuncture on the cat. And also, this particular cell, the nucleus, stains blue. The blue dye identifies cells that are making new proteins. Okay, so to make the whole story come together, Dr. Longer, people say this serotonin neuron now is activated to make more new proteins, and that these proteins are in fact endorphins. So it's very complicated, but in other words, at the cellular level and molecular level, we scientists can show that acupuncture could lead to production of endorphins in the brain cells, and that going back to here, this is probably why acupuncture could relieve the cardiac problems here, and that this action could be blocked by naloxone. One more, okay. Dr. Helena Langevin, who is head of integrated medicine at Harvard, okay, made a different discovery. She's trained as an MD, okay, and her interest is actually sports medicine, okay. And here you see a picture of what happens when the needle goes in, okay. In acupuncture treatment, the needle goes in, and then the doctor will like twirl it, like that. You don't just put the needle in and walk away. You put it there and you twirl it. And when you twirl, see the finger twirling, okay, here's the handle, here's the needle. You get this tenting effect. It's like the needle is grabbed, it's called the needle grab. Grabbed by something underneath. Okay, if you put the needle into a bowl of Jello or tofu, well, nothing happens if you twist. Okay, right? If you stick it into some really sticky material, okay, like a really, really thick honey or something, and you twirl, you roll a whole ball of stuff. Okay, so what's underneath? There's grabbing the needle and forming this sort of stuff. Connective tissues. So in this highly magnified picture, the needle goes in through the different layers of the skin, all the way deep, 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 deep in, okay, and in the connective tissues. And when you twirl the needle, oh, it's like winding up cotton candy, okay? So here's the diagram, okay? The needle goes in. This is the connective tissue, molecules, this three-dimensional network. And it's called connective tissue because a lot of other cells are connected by this whole three-dimensional network. And when you twirl, okay, you don't just disrupt the connective tissue, but you disrupt all the cells that are bound to it. These cells will change shape when you do that, okay? And when they change shape, they start secreting, among other things, ATP. And so those of you who've been coming to this series, you know what the next slide is going to be. The ATP is going to activate, receptors at the end of nerves, and the nerves send a signal to the brain for pain relief, anti-inflammatory action, and so forth. Okay. So here we're saying that when the needle goes in, nothing happens. But when you start to twirl, okay, then you affect the connective tissues, which affect all the other cells connected to the connective tissue, and they start to secrete all sorts of things, among which is ATP. ATP binds to certain receptors at the end of nerve terminals, and they send a signal to the brain to say, okay, brain, we need pain relief, we need anti-inflammatory action, and so forth. So this is yet another pathway of how acupuncture could work. And not only that, you've seen this before, those of you who've been here. Yes, you put the needle, 12, you get that. But when you do stretching exercises that I've been teaching you in Qigong, Tai Chi, and Kung Fu sessions that you've been coming to, same thing. How about tonight? Okay, tonight I'll teach you how to stretch yourself, by doing massage. Okay, when you massage, you certainly stretch the connective tissues, and you can have anti-pain, anti-inflammatory action as well. So one more just to put in the plug for ourselves, blood circulation. We already said that when nitric oxide goes up, theoretically blood circulation will go up. So here in our laboratory, we use laser Doppler to measure blood flow. Okay, so here the needle goes in, we have a probe here, and you see when the needle goes in, blood flow comes up, and then it will come back down, and then the doctor can 12, okay, 12, and then boom, goes up again. So we can really show that acupuncture can increase blood flow rather easily in the laboratory as well. Okay, going to acupuncture-related therapies. So, see, I wanted you to have some basic knowledge on the science of acupuncture points. But tonight, I'm not going to teach you to do acupuncture, although I can, but I'm allowed to. I could teach you, how to put finger pressure on acupuncture points and achieve many beneficial effects. So, related therapies like what? Okay, like putting finger pressure. So later on, I'll tell you how to put finger pressure along the sides of the backbone. Okay, these are acupuncture points, and in terms of Western medicine, we know them as something else. We know them as points where your autonomic nerve comes down the spinal cord, and then they branch out, okay, to feed the heart, the stomach, the liver, the kidneys, the bladder, okay. These are organs that are under autonomic control. Unlike the muscle, you can do this and do this, but your internal organs, they are also under control without your consciously controlling them. So they are under autonomic control. And under autonomic control, because the autonomic trunk comes down and sends branches down there. The branches come down this way. So according to both Chinese medicine, okay, this is a student of mine who went on to get a degree in Chinese medicine and Western medicine. She got a degree in Western medicine. And one day I just got them to, this is actually me, okay. So I gave him a blue pen and gave her a red pen and said, well, draw on my back, without looking at each other, what you learned in your medical school. And they draw these points, and they actually, correspond to these points that you can see in the anatomical atlas, that these points are points where the autonomic nerves go feed the heart, the lungs, the liver, and so forth. So the principle here is, if you're fine, okay? But if your back is crooked, not many people have crooked spines, but let's say your back muscles are really tight, your tendons are tight, they press on these nerves, okay? When you press on these nerves, then they don't send enough signal to the heart, the lungs, and then you can have problems other than a sore back. You can have internal problems. So in Chinese medicine, as well as Western medicine, they say if you loosen up these tight muscles and tendons, it could relieve a lot of problems, not just connected to back pain, but maybe even internally, kidney function, lung function, and heart function, and so forth. And in terms of the acupuncture point, the names, right? Instead of, this is the bladder meridian, instead of bladder number 14, 15, 16, 17, 18, okay, you're not really getting the true meaning. This point in Chinese means junction to the heart, junction to the liver, junction to the kidneys. The Chinese people figured that out 2,000 years ago and named them appropriately. So, okay. In our laboratory, we showed that, if you massage, okay, you will warm up the body. So using infrared camera, we'll see this is an acupuncture point before and after. It really warmed up a lot. And in terms of blood flow, okay, normal blood flow, highly elevated. So we can see that when you massage these points, there are measurable changes, such as blood flow. One more study. This was done by Steve Kane, the head of anesthesiology at the UCI Medical School, who used to be a professor of anesthesiology at Yale Medical School. So Dr. Kane and his collaborator, Dr. Shuming Wong, okay, also MD, she's also an anesthesiology professor, who came with him from Yale to UCI. They did a very important study, okay. So they were very interested in stress, how stress affects patients going into surgery. So talking about stress, okay, going into surgery, obviously you're under stress. And they have already published a number of studies showing that patients who are stressed are not going to do as well as patients who are not stressed going to surgery and coming out, and they can measure the medical outcomes of people after surgery. And the outcomes are a lot better if they go in not as stressed. Okay? So in this case, they put pressure, not needles. Okay, so something you can learn tonight. Pressure on this particular acupuncture point. And when that happens, the stress level of the patient went from here to here, measurably decreased, just putting pressure here. Okay, and you always need a comparison. So instead, unbeknownst to the patients who's naive to these acupuncture points, instead of putting pressure here, put the pressure here, no drop in stress. Okay, these patients look very good in the eyes and bright and all this. I'll show you how to do that and make yourself look good. But they're stressed as hell, okay, but they look good. So this is a very important study relevant to what you will learn today. That you can de-stress yourself, stress relief, if you push on the right points. If you push the wrong points, all of a sudden you look really good. It's de-stress. Okay? If you need any other proof, for $7.95 you can go to Save On, Rite Aid. You can buy, elastic band with a rubber knob that you can put on this acupuncture point, and this would decrease nausea. Okay, like if you're going to go deep sea fishing, or if you're going to ride at the back of the car, going on a mountain road like this, or God forbid, if you ever need chemotherapy. Okay, nausea is a major problem, and acupuncture or even a knob on this would decrease your nausea. And you can go to Brookstone and buy these da-da-da-da-da-da-da, or in our lab we have heavy duty, and these things all work very well. Doesn't need to be just a finger. Finishing up, okay, what other methods you can use to stimulate acupuncture points? Okay, so on schedule in another 5 minutes. Okay. Electroacupuncture, I touched on that very quickly. So nowadays things get more high tech. In the old days, you put the needle, you twirl the needle. Okay, if you're really good, you can do that fast or slow and so forth. But nowadays, you can instead, or in addition to that, okay, put electrodes on the needle, and then set the instrument to go ta 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 or ta 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 ta. You can dial in the speed, okay, and you can stimulate electrically as well as mechanically, that acupuncture point. So why do this? A UCI calculator shows that if you do electroacupuncture, actually you have longer lasting effects. Okay, so the high-tech method is actually superior to the old manual method. Then Dr. Han at Peking University showed something even more remarkable, that if you send slow pulses like 2-3 hertz or ta 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 ta, or you send really quick ta 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 ta, the brain sends out different chemicals. Okay, so it's like a prescription form. Like, okay, well, give them this, give them that. Okay, so at low, okay, low ta 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 ta, the brain sends out an endorphin called enkephalin. But if you go to high speed ta 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 ta, the brain sends out some endorphins called dynorphins. And dynorphins and enkephalins are both in the class of chemicals called endorphins, but they have different properties as well. So you can now get the brain to send out different molecules by varying the stimulation rate. Tonight I'll also show you that if you're afraid of needles, okay, or you don't want to go see an acupuncturist like every day